All right, welcome to our January 5th Northeast Regional Report Out call here. We're doing these every week at 2 o'clock on Tuesdays. You can watch it live on this YouTube channel, or you can sign up. I really encourage people to sign up via email. That number's been growing every week. covid.ks.gov/report-outs. That's with an S on the end. covid.ks.gov/report-outs. And if you have questions or comments you want us to consider, please send an email to ksregionalreport@gmail.com, ksregionalreport@gmail.com, and just tell us you're talking about the Northeast region. And we'll keep doing these calls all through January as we monitor kind of the situation in our healthcare system as it revolves around COVID. Okay, so let me start by showing this dashboard that our friends from the Hospital Association are so kind to produce for us every week. Two things you'll notice immediately that are a little different than previous weeks. And this dashboard does get sent out in the email every week. But 86% of hospitals, some of the smaller hospitals, due to staffing and issues around the holidays, didn't get the numbers in time. The number of people anticipating staffing shortages this week, when the year crossed over, the default changed to no issue on the federal entry into that. So we're going to work. I know KHA is working to help us get a more accurate count there. That's something that changed, and will get worked out. Coming down here to the ICU beds available and the percent of ICU beds available. About 105 total beds, adult staffed ICU beds in this region, 24 available this time yesterday when they produced this report. Dynamic situation, so this does move. Now 23%. When you come down here too, we did see what we thought, which was testing, and obviously the number of positive tests goes down the week of Christmas. Is around the holidays, not as many people go in and get tested, not as many days available. We have seen this jump. This is really consistent across the state with that 31-47. So really go back 4 or 5 weeks to see that number. And we're just watching to see if there is a holiday bump at the end of this. And we'll start to see that probably this week, next week, week after. We'll know really the severity of that. And then, here to the second page, you can see the county layout and the percent of the population that's tested positive, and then the ICU census. Just important to remember, this time of year, hospitals are generally busy. Having a high number of non-COVID patients in ICU is not abnormal. And so, you can see what's going on there with the ICU bed census. So let me come on back to this group, and let's pitch it over to Jen if she can give us an update from the public health standpoint. Jen?
Hey, so yeah, we are seeing some holiday activities or end of the year activities are impacting our current case count locally. That's what we've mainly been looking at. Basically, we're seeing a rise because people wanted to finish on a high note. They were trying to complete morale and do the things they've always done. And I think that this was maybe the year that we could have tried to find some more alternative activities for that. Because the side of the downstream effect was that unfortunately it got everybody sick. So we are still seeing a rise in cases. It's gone up every day since the holiday. And like you said, there was a dip because the labs were closed and we weren't doing testing. So we anticipate seeing this continue to rise. We got some snow in our area, so I think that also will have an impact on our case count as people move their activities indoors. So we just really want to push the wear your mask, socially distance. All these behaviors really are making a difference. It may not feel like it some days, but they really do make a difference. And just remember that it really is helpful for other people for you to wear your mask. You're on mute, John.
Can you give everybody your title and where you work?
Yeah, sorry. I'm from the Lawrence Douglas County Public Health Department. I'm the epidemiology supervisor, and my name's Jen.
And how's the vaccine rollout going out from a public health standpoint for you guys?
We're still working on our tier 1 like everyone else, and I think it's going cleanly. We haven't been backed up. We haven't had issues at the end of the day or anything like that. They definitely have a tried and true system in public health, and we have a very good group of people that have been working very closely together to make sure that this goes off very smoothly, and they're doing a fantastic job at that.
Yeah, and we're hearing, I talked to KDHE this morning, and we're hearing through the report outs here, a pretty efficient distribution in Kansas. They used a hub and spoke model. One of the few states that got it out to all counties in a state. We have 105. And they're having, it does sound like it is a software glitch as far as how we're reporting nationally on this. And even some of the larger systems are having some issues with it. So hopefully that'll get worked out. But the tier 1 is going. I know some hospitals this week started their second, the booster shot, which is good. But in even some of the larger metros today, there was a clinic going in Kansas City where they're going to get 1,400 people from tier 1 in the healthcare done. Also, I'm hearing that there'll be a website put together at some point for people to go as a resource to see where they go, and that the governor will be laying out her plan hopefully this week around the vaccine. So more information to come. We'll talk about the vaccine on these calls as it's data driven and as there's information to share around that for everybody. As I know, a lot of this is a race of getting the vaccine out and the against the spread of the virus. So anything you'd want to add to that, Jen?
Yeah, earlier today we've been talking a lot about our testing strategy locally, and that is exactly what we mentioned. We're in a race against time. Like, the more we can get people tested is great, but trying to get the vaccine before we run out of the capability to test as much would be very useful. So we're doing as quickly as we can get the vaccine. We're rolling it out, but also don't stop testing.
Yeah, thank you very much. Let me pass it over to Sarah if she can talk a little about what's going on from the hospital side.
Sure. Thanks, John. My name is Sarah Gideon. I'm with the Health Innovation Network of Kansas. So day to day, I serve 16 hospitals in the Northeast Kansas region. The region that we are talking about today encompasses up to 23 counties, not including the metro area in Kansas City. So we have a variety of small and large hospitals within our region. I was listening to Jen talk about meeting with friends and family, and I realized the sign over my shoulder says "Friends and family gather here." I think I should have taken that down for COVID, because we haven't been hosting people in our home due to this. So would echo what she says. In order to help our hospital staff out, please continue to wear your masks, social distance, be outside as much as possible if you'd like to see people. Just a few things that I wanted to highlight from our hospitals. My organization does a biweekly COVID survey just to hear what's going on in our facilities. And two of the things that were highlighted in our most recent survey as issues were staffing, especially on the acute nursing side, as well as staffing morale. They've had a long and arduous journey over the last, we're looking at almost a year now. And so our public can really help out with that. Today, I wanted to do something just a little bit different, and I wanted to share with you some words from a friend who is a nurse that she shared on social media, and she is a nurse in our region. She said, "Folks, things are really tough at my job. People are really sick and dying. COVID is real, taking a toll on our loved ones. Please stay vigilant and keep those healthcare workers and first responders on your prayer list. The emotional toll is overwhelming." So we really have an opportunity to help our hospital workers, our first responders, and all of those that are providing care out with the actions that we have. This last week, we have about 160 COVID cases in our hospital beds. That's down slightly from last week when we reported out at 173 COVID cases. As you showed with the dashboard, we do have additional cases. We're up about 22% from last week within our region. As one of our earlier report outs that I was listening to, one of the providers said, we're hitting the ground running coming out of the holiday. And we really are. I know there was a slight decrease in staffing. People were taking vacation if they could, being with their loved ones if they could. But now we have to really be prepared for what's coming next. We continue to hear of hospitals in our region that are having other hospitals looking for beds outside of our traditional transfer patterns. Richard might be able to speak to that a little bit more, but we are seeing hospitals from areas we don't normally serve calling and looking for bed space. So I do want to turn it over now to Mindy Olberding. She is the Chief Nursing Officer at Community Healthcare System in Onega, and Marika Surdez, who is an APRN and serves as the Chief Provider and Clinic Operations Officer. So Mindy and Marika, I'll turn it over to you once you get yourselves off mute.
Can we hear you? You guys are off mute, but we can't quite hear you. Maybe if you could sing, if you hold the note when you hit the right button, we'll know.
John, it doesn't say that they're connected by audio.
Oh, just video. Should they re-sign in? What do you think's the right thing? We can kick it over to Dr. Watson real quick and they can maybe sign off and then sign back in. You okay doing that?
I'll send him a phone number, John.
Okay. Thank you very much, Megan. That's Megan, who's been behind the scenes making all this happen. The great and powerful laws right there. So as they're working through that, Dr. Watson, can you talk a little bit about what you're seeing from that transfer situation?
Sure, and thanks. With Cheyenne Mountain Software, who's monitoring kind of state resources as well as helping with transferring of patients and finding beds for patients. So, you know, this is current right now as to the traditional receiving hospitals and kind of where we are. We don't track individual bed numbers. We track more general capacity so that we have a general idea of how much difficulty there is in the system to find placement. And honestly, this has been the last couple of days, and I think it speaks to where the system is struggling the most right now. It's primarily the tertiary and quaternary receiving hospitals that are taking the sickest of the sick, and I think that speaks to what we're seeing on the transfer side. The numbers look remarkably similar to the last several weeks, where you've got between 30 and 40% of the patients are COVID suspected. And about 40% of the time, people are looking for beds when they request transport. And the acuity index is between 10 and 12, which is sick and but not horribly sick. But I think the difference here is what we're seeing in the development of two groups of patients. One are mildly to moderately ill patients who can be taken care of either locally or at regional centers without having to utilize ICU beds. And then we're seeing very sick patients who require complex treatment regimes and a lot of care and have to end up in an ICU bed at one of the tertiary quaternary centers. And so the numbers look the same, but but what's really happening there is the system is being backed up because of the strain on those ICU beds at the larger hospitals. Fortunately, regionally and locally, we're seeing some give, that we do have some capacity there that had not been there several weeks back. And so that's encouraging. I think we're all waiting to see what these next couple of weeks will bring. If the surge in positive cases will end up being hospitalized cases, it will definitely impact the system adversely. We'll be back where we were in mid-November for sure. So just an agreement on the fact that we stay the course as we go into the new year, have renewed commitment to continuing the plan here. Just because we changed the year did not mean we changed the situation. I think everybody wanted the new year to mean something entirely new, but honestly, January 1 was just like December 31st, and we need to remember we've got work to do here over this month to make sure the spring looks better. So.
And Dr. Watson, you may have to let Mindy in via phone number if you see them on.
There you go.
There we go. And so I just want to ask a question on your first screen. That's a live tracker, and so this would be something you'd go to for all the tier 1 hospitals in the state that can take the more acute patients. And they're saying, hey, we're full on ICU. Is that what the red means?
Yeah, and we work the secondary ones as well, and we're seeing normal capacity more than we had been previously on the secondary hospitals, and knowing that there is some give room there. Again, I think we get way too complacent and used to the fact that we are really on the edge. And sometimes we talk about how much easier it is when in reality it's a 5 to 10% change in capacity issues, which is honestly not very much in the scheme of things. One day can totally eat up all of our resources, one bad day. And so we've got to remember that it is very, very fluid at this point.
Yep. Okay. Yeah. Thank you. Obviously, concerning dashboard there, but I think we have our friends are available. They'll still need to unmute that, and we'll kick it back to you guys. Uh-oh. You're showing muted on here. Dr. Watson, I think if you click on their top right, there we go. Let's see.
Can you hear us now?
We can. There we go.
Good. Oh, so love-hate with technology sometimes. Well, thank you so much for having us join the meeting. I am Mindy Oberdeen with Community Healthcare System. I'm the Chief Nursing Officer, and I'm going to speak first, and then I'll pass it over to America. Just going over staffing and stuff. We are currently doing okay acute-wise in our staffing. Of course, we've learned throughout COVID that staffing complexities can change in a less than 24 to 48 hour period. And we have experienced that through one of our long-term care facilities, which ended up having over 16 staff members out at the same time that they were having a cluster of COVID, which, if you can imagine, puts us very much on the just trying to do anything we can preventative-wise to keep our staff safe so that we can protect our workforce and keep them from getting COVID. So we do a lot of the, not only here at the hospital, but when you leave, mask, social distance, hand washing, et cetera, with them. So right now, it's not doing so bad. One of our challenges, though, staffing-wise, is this having the complexity of patients that COVID brings when we struggle to transfer. So we are taking care of higher acuity patients, which is not our forte, and just getting our staff more comfortable with those patients. So we would be taking care of ICU level patients. Normally, pre-COVID, would be able to transfer them within a matter of less than an hour, and now sometimes we are taking care of them 8 hours or more as we wait for beds to open and have conversations back and forth so that those tertiary hospitals can make the best decisions regionally for which patients get admitted. So I would say that that is probably one of our most challenging points with staffing. And we're doing lots of education to try to get our nurses more comfortable with the care that they provide. As far as our long-term cares, we are on the offense for the first time in the past couple of weeks with the vaccine rolling out, and there's been lots of excitement to hear about that. We have given our first tier to all of our healthcare staff, and then we've also had 2 of our 3 long-term care facilities receive their first doses of vaccine. So we are very excited to be on that other side, hopefully, as we fight the pandemic. As far as PPE goes, we are doing much better in PPE. We actually have a really good supply of gowns, gloves, and masks. We still have some contingency strategies with our N95s, as those are still a little harder to get because they're model-based, and then you have to get them fit tested, and it's just more complex. But we are getting our staff more used to their previous COVID processes when we weren't having to restrict the use of PPE. So that's been exciting in the last couple of weeks. As far as testing rates go, I'm going to have America talk about that. She tracks the testing rates in our facilities and also is over our providers, so she can give us some good detail on what that is looking like for our facilities. We have, as far as the hospital goes, I would say over the past 2 months, we've been pretty steady in our number of COVID patients, and those range between 6 and 8 a day, depending, and they could be in all different ranges of their process, from acutely sick with COVID to recovery phase of a COVID hospitalization from a higher level of care to most recently, we've been getting patients who have had COVID, but then they come into us later with secondary issues, and those range from continued fatigue to secondary pneumonia. So just the gamut. They're not in isolation because they've already had COVID, but it's generally days 15 to 20 is when we're seeing those come in. And then we do reach out to the larger hospitals and have been open to accepting patients that are not within our system to help open up beds. And we've done that, I would say, 6 times over the last month and a half, where we've had patients that are not ours in our facility, but we had an open bed and could help take the patient and take the load off of the bigger hospital, and have done that. And so we will continue to do that. So I'll turn it over to America.
Hi, yeah, my name's America Surtees. I'm a nurse practitioner, and I am newly, in the last several months, I'm the Chief of Provider and Clinic Operations. So I'm the manager of our outpatient clinics and specialty clinics. We have 6 different regular clinics and 2 specialty clinics. As far as staffing, my providers are doing pretty well. Late fall, early winter last year, I did have 3 providers that were out at one time. So that was challenging because our physicians cover both clinic and ER. So we found ourselves in a pickle a couple weekends in a row. Right now, nurses are really my biggest challenge. I have a lot of nurses who are young moms. And so, you know, once it gets in a household, that quarantine can be very, very long. And then I've also had a couple nurses that have had COVID and then just not recovered as quickly as you'd anticipate, you know, out for 2 weeks instead of the 10 days and then coming back part-time for a period of time due to fatigue and shortness of breath. But we're getting through. You know, one of the benefits of having so many different locations in a relatively small area is I can usually pull from my other clinics to make staffing work. So it's a challenge each week, but we're getting through it. Another challenge for us right now is testing supplies in the outpatient clinic setting. We have several different platforms. We have one antigen, the Sophia 1, and we're trying to implement the Sophia 2, which would be COVID and influenza AB combo. And then we also have the Cepheid, which is the PCR point of care test. And for all of those platforms, for example, the Cepheid, we ordered 30 kits in December and we were allocated 8 for December and January. And we're prioritizing those for ER and inpatients only, as well as some OB and emergent surgeries. As far as our antigen testing, we have a total of 2,400 orders out right now, and we have 700 in stock at our facility, and we don't know when we're going to be allocated more. It's a pretty big frustration. We'll often be told by manufacturers that they are in transit to our facility, and then no, they're not, and they're not going to be there for a month, and we don't know how many you're going to get. So that's a really big frustration from the administrative standpoint of trying to coordinate that, and then also from our providers wondering why what we say is going to happen isn't actually going to happen. But we're working through it and just trying to deal with what we have right now. As far as our numbers, our positivity rate this week was up compared to last week. I can't remember the last time that we were below 20% positivity rate. It would have been last summer. Yeah. We range anywhere from mid-20s up to low 40% positivity rate. We did see a drop in testing last week to 105, and that includes all antigen and PCRs. A fourth form of testing is we do have the send out PCRs as well that we send to Stormont. So when I'm referring to these numbers, it includes all platforms of testing that we do. So last week we did 105. The week before was 149. So it's pretty variable, but our positivity rate is consistently high. So right now in the long-term care setting, we're struggling with false positives. You know, they're doing the asymptomatic testing of staff routinely, and it's been daily for quite some time. Our second nursing home has an outbreak now following our first one. And in the last couple of weeks, I think we've had 4 to 5 false positives on antigen testing. So that's relatively new for us. We've had some false negatives, but not near this high of false positives.
America and Mindy, thank you. That's a great report out. And you guys are in Onaga? How do you say it, Onaga?
Onega.
Onega. Gosh, should have known. Kansas. Yeah. Onega. Thank you guys very much. It's really helpful to hear what's going on. Kind of on the real boots on the ground perspective. So, let me ask Sarah, anything you'd want to add to that? Jen, Dr. Watson? No. Oh, well, we're coming up on time here, and it's interesting to hear about the testing supply issues. That's one we haven't heard yet, and it's important to know and is real out there. And as caseloads go up, obviously we may see supply issues in more places. So we'll be back here at the same time. I didn't have a specific bright spot from the Northeast. Let me look just real quick here.
Hey, John.
Yeah.
I will actually give community healthcare system a little kudos over the holiday season. They did a lot of different things for their long-term care residents. And one that I thought was really great is they did a in the facility deer hunting, went room to room with Nerf guns and little stuffed deer and things like that, and really have worked hard to give additional activities to their residents who aren't seeing the kind of visitors that they normally would have. So kudos to them and to the other facilities that are working hard to keep people's morale up as patients and as residents.
Yeah, that's a great bright spot story, Sarah. Thank you for sharing that, and great creativity. That sounds like a fun activity. Indoor deer hunting. I might have to try that at my house. So yeah, really grateful for that. And the morale issue is real. And I think coming out of the holiday and that vaccine lift that everybody got, and we're seeing what we're looking like we're going to face in January. Just a reminder out there to communities to figure out ways to care and remind people that are out there on the front lines for us that they're loved and supported. So we'll say that here. We're grateful for you all. Mindy, America, thank you. Jen, Sarah, Dr. Watson. We'll be here again at 2:00 next week, every Tuesday. Please sign up for the email. You get the dashboard and a link to this conversation. And that is at covid.ks.gov/report-outs. We'll see you the same time next week. Happy New Year to everybody.